Social determinants of health include education, community, and economics. Weaved in all three of these is race. I'm going to share with you very simple questions to answer as you're looking into analyzing social determinants of health while going out into the community to provide better health care for your constituents. The first set of questions are centered around neighborhood and built communities. What do you know about the place-based racial histories of the neighborhoods that you serve? How can this knowledge inform your analysis of the communities your grantees serve and overall project success? If you are granting communities that are racialized, do the research. Find out why. Is it because this particular community fits a certain culture or certain ethnicity because of location? Is it more so connected to policies and practices that were created, for instance, like the GI Bill? Really look into the history of race in that particular neighborhood, because that will tell you a story, and that story will paint a picture on how to go about providing the best healthcare possible. The second set of questions is centered around economic mobility. How can you partner with organizations who are working to eliminate discriminatory hiring practices? How can you analyze internal hiring practices? Now, why is this important? This is important because if you're looking to advance economic mobility within a particular neighborhood, the first question to ask is, where's the money? Where is the money, right? What is the income of the constituents within that neighborhood? What are the jobs in that neighborhood? And are there discriminatory practices specifically surrounded and centered in race? That's the question for you to ask. And then take the next step further by connecting with those companies that are hiring people within that community to partner and say, hey, let's look at our racialized history in this neighborhood. Let's also see if we collectively have discriminatory hiring practices. The third set of questions are centered around education. What are the education statistics by race, region of the city? And how are you preparing for organizational-wide education within your organization's strategic plan? Take the time to analyze the statistics of race within a particular school district, not only to see who's performing more than others, but also look at statistics based on majors and electives. Oftentimes you'll see skewed numbers when you look at race and when you look at majors, whether it's looking at humanities, the arts and sciences, STEM, and business. And we begin to connect the dots and looking at the humanities and then tracking the amount of income that each of those particular industries will bring a person. What do those numbers look like across race? And how do those numbers paint a picture of your entire community? Analyzing social determinants of health with a heightened lens and race will not only help you to save lives, but will help your healthcare system impact and improve the bottom line. I'm Jada Monica Drew with SocialDesignsConsulting.com.